day everyone, my name is Loie J. Strada from MSU-1 and today I am going to perform assessing the cardiac and peripheral vessels. So, a thorough assessment of all systems is required to discover peripheral and systemic consequences of cardiac problems as well as the evidence of non-cardiac conditions that may have an impact on the heart. So, this is for subjective evaluation of the cardiovascular and peripheral vascular systems, and it is critical for detecting the indicators of possible malfunction. This is also to detect the disease to the peripheral vascular system. So prior to the conduct of the procedure, I am going to close the door, secure patient privacy. I'm going to need to provide an adequate lighting and adjust room temperature for patient's comfort. Then, I am going to gather the necessary equipment. So, I am going to use the stethoscope. So, I have it here. So, now I am going to disinfect it using an alcohol. Okay, so now I am going to do hand washing or apply an alcohol. So, hand washing or hand hygiene prevents the spread of microorganisms. Okay, so now I am going to introduce myself to my patient and verify his identity and of course explain to him the procedure that I am about to do. So this reduces anxiety, promotes compliance, and prevents from embarrassment. Okay, good morning sir. I am Loie J. Strada, your student nurse for today. May I see your wristband please?
Yes.
Okay, please state your complete name and your birthday please. Okay, so now I am going to assess your cardiac and peripheral vessels. Is it okay with you? Okay, that's good to hear. So, I'm going now to palpate the carotid artery, then lightly place my fingers just medial to the trachea and below the angle of the jaw. So, the pulse should be regular rhythm and equal strength for both arteries. So, this is also to identify if the palpable vibration of frills are present. Okay, now sir, I am going to palpate your carotid artery. Okay. Okay, so the rhythm looks normal and the strength of the artery is equal. Okay. This also is the same to the other side. Okay, that's good. Okay, so now I am going to auscultate for vascular sounds over the carotid arteries. So this is to determine the presence of a bruit. Okay. Now I am going to check your carotid pulse. Okay. Okay, let's check the other side. Okay, the rhythm looks normal and the strength also. Okay, then I'm going to inspect the internal and external jugular veins and to determine for the type of pulsation it produces. So this provides information about the blood volume and pressure on the right side of the heart. Okay, so I am now going to inspect your internal and external jugular vein. Okay, please turn to the right side. Okay, so there is an external notch here. Okay, and I could identify the internal jugular veins because of this notch. Okay. Okay, that's normal. Okay, the external jugular veins also. Okay, that's good. It looks fine. Okay, you can now relax, ma'am. Then I am going to inspect and palpate the aortic and pulmonic areas. I am going to note for any pulsations. So this is to be able to gather the rate or rhythm and of course the characteristics. Okay, so now I'm going to palpate your pulmonic and aortic. So I'm going to palpate first the aortic. Okay, it's good. It's normal, it's fine. Okay, how about the pulmonary? Okay. 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 It's normal, it's fine. Okay, please relax it. Okay, so now I am going to inspect and palpate the epigastric area at the base of the sternum for abdominal aortic pulsations. So this is to identify if there are unusuality in the abdominal aorta and also provide prompt nursing interventions. Okay, so now sir, I'm going to check your epigastric area and I am going to open your abdominal areas today. Okay. I'm going out of a base and the gastric area. Okay, it looks fine and there's no unusuality. Okay, do you feel any pain here? Okay, it's good, it's normal. Okay, thank you sir. Please relax. So now I am going to place the client in a semi-Fowler's position. Then I am going to auscultate the aortic, pulmonic, tricuspid, and apical area. Then I am going to use both the valve and the diaphragm of the stethoscope. So this is to identify the adventitious heart sounds. Okay, so I have already placed my patient in a semi-Fowler's position. Okay, sir, please relax. Okay. Okay, I'm going to auscultate this. Just relax. Okay, so first I'm going to auscultate your aortic area. Okay. Okay, the sound looks fine and it's normal. Okay, so now I'm going to check the pulmonary. Okay, it's also the same. So I am using the diaphragm of the stethoscope. So now I'm going to check for the apical folds. Okay, it's right here. Okay, the sound looks the same, it's normal. Okay, so now let's check the tricuspid. Okay, it's also the same. So now I am going to check it again using the bow of my stethoscope. Okay, it's good, it's the same. Okay, it's fine also. This one right here, the rhythm is also the same. And also the sound, the strength of pulsation. Okay, it's normal. Okay, it looks fine and good, sir. Okay, please relax. Okay, so now I am going to inspect the peripheral veins in the arms and legs. So I am going to note the color, the temperature, and any presence of edema. So the peripheral edema is leg swelling induced by the fluid accumulation in leg tissues. Okay, so I am going to check the peripheral veins. Okay. Okay, the color is normal. Okay. Okay. Also, there is no presence of edema. Okay, the temperature also, it's normal. Do not hurt. Okay. Okay, it's the same. It's normal. Okay, so now I'm going to check your legs, sir. The peripheral veins on your legs. Okay. Okay. Okay, so there's no lesions. It's lesion free. Okay, it looks good. It's normal. Also the temperature. Okay, how about the other side? Okay. Okay, so it's also the same. And there's no presence of edema, meaning it's lesion free. Okay. Please relax, sir. That's good. Okay, so now I am going to assess the peripheral leg veins for any signs of edema, varicosities, and phlebitis. So I'm going to grade for the bleeding edema as 1 plus, 2 plus, 3 plus, 4 plus, according to its depth. Okay, so overlying erythema in the vessel distribution and discomfort on examination are signs of phlebitis. Okay, so sir, I'm going to assess your legs. Is it okay with you? Okay. Okay, I'm going to check for the bleeding edema. Okay. So, okay, so, okay, so there's no sign of bleeding edema. Okay. 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 It's normal. Okay. Okay, sir, please straighten your legs. Okay. That's good. So there's no sign of phlebitis and varicositis. Okay. So you're fine, sir. You're good to go. Okay. So now I am going to assess for arterial and venous insufficiency. So both issues may result in slow healing of the leg sores. Okay, so I'm going now to check your arterial and venous insufficiency. Okay. Okay. So there's no sign of those. You look good, sir. Okay, it's normal. Okay, it's turning back to normal. Okay. 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 Okay, sir. Thank you for your time. So now I am going to document procedures done and of course report any abnormal findings. So this is for legal purposes and for future references. Okay. And we have to remember that what is not written is not done. Thank you for listening.